to assist and champion the cause for providing better health services for the people of Grenada, Carriacou, and Martinique, and even working to boost the morale of our staff, because we also understand that that is so very important and there are many issues. Last weekend, as many of you might have already heard, we had a community-inspired cleanup of the external and some parts internal surroundings of the General Hospital. I want to use this opportunity to thank the scores of many people who participated in this activity. But I also want to place on record our special thanks and appreciation to M&N Hardware, Francis Mohan and company, who spearheaded that initiative, who provided us with all the cleaning agent, all the brooms and all the mops and everything that we needed to accomplish that deep cleaning we had at the General Hospital. I also want to thank those who gave the food and the cooks at the Maribor Hospital, and the other members of the business community who assisted us. I also want to thank my colleague, Minister Louis, who reached there before me and surprised me by being there, because I only asked for assistance from members of the different constituencies. So I want to thank everyone for being there. So this is just the first phase in terms of the cleaning. Second, in November, we would see, we realize that there are some issues of mold on the walls in our cleaning, and therefore many businesses reach out to us after that first phase and after we posted. So while there are some who believe that it should not be posted, but that was awareness, because people even living abroad have committed to providing assistance as we move forward. So in November, we will have the removal of molds. Some professional painters will give a facelift to the General Hospital. And then we will proceed with beautification as we go into the Christmas season, bringing cheers and joy on the faces of our patients and even our healthcare workers. And we are even going bigger, because in that first phase, we have introduced what you call adoption of award. And we were happy by the outpouring of support from the business community, Corporate Grenada, who are willing to adopt award for providing beautification and minor repairs. Major repairs are always the responsibility of state, but the business community will assist us if a door go bad, a window go bad, or painting and beautifying. We will have that program launched in short order, where we will give them the adoption certificate of the particular ward that they are adopting. And we also call on the other members of Corporate Grenada to join on board as we look to solve and tackle all the issues that confront us as in the healthcare sector. As importantly as cleaning the surrounding of the hospital was, and most significant about the weekend, is that we were able to send a signal to the entire national community that we are determined to involve all levels of the community in finding solutions to our problems. Indeed, the challenges are great, but not insurmountable. Through the grace of God, because I believe that if God has led me thus far, then He will see me and the team through. And so I am counting on Him to lead us through. I am extremely hopeful that together we shall rise to the challenge of the moment, and we would not be focusing on the past, but we will be inspired by what can be. When it comes to hospital services and community health services, let the period of recrimination and pointing fingers be over. Let a new period of accountability and possibility begin. We are committed, and we will work to ensure that we provide the necessary services that is needed for healthcare. And as just yesterday, I want to report that Cabinet, after our discussion and our deliberation and our way forward with our managers at the hospital, Yesterday, Cabinet approved the hiring, the service, hiring the service of a urologist, and also approving the procurement, the finances for procuring new equipment for the urology surgery. As we go forward, as we look at the different challenges that confront us in the healthcare sector, as we also appreciate that it cannot only be about hospital services, we also have to look at prevention. We also have to look at those issues, for example, those lifestyle diseases like diabetes and hypertension, that after the lockdown we have seen scores of persons falling sick with stroke and other complications of those lifestyle diseases. And so education must be an integral part of what we do at the level of the community. Decentralization of services will also be on our agenda as we look to make healthcare more accessible to our ordinary people. We will work with central government in terms of addressing all or most of the issues. We also appreciate that cancer is the leading cause of death in Grenada, and therefore we ought to look at an aggressive program in terms of education, because a lot of the cancers are can be prevented and can also be dealt with early if you do follow take your particular examination, like a pap smear or the breast test and all those stuff. So we will be working to ensure that we deal with those issues, and not only the issues of services, but we are also aware that there are issues as it relates to our staff. We know that some of our staff are demoralized because of particular issues. And so we will work together with the management and with our staff. We'll be there with them. We'll be hearing from them. We'll be on the ward with them, and therefore better able to address those issues. So in the coming weeks, you will get more of what we're doing as it relates to healthcare. In our budget, which will be sometime next month, you will get a more detailed agenda of how we move forward, how we decentralize the services at the level of the community, how we provide more services at Princess Alice, and how we look at the new facility in St. John's in terms of providing additional and 24-hour services for the people of our country. And so we'll also look at those issues, the issue in Carriacou as it relates to transporting patients. That is high on our agenda, and so we are working to ensure that we come up with a workable solution that will make them comfortable in time of sickness. So I want to pass on to the PS. I need her to get her feet wet, and so to speak to us on some of the issues as it relates to, or the way forward as it relates to the community health and any other thing she think it is important that I left out that we want to highlight here this morning at this very important press conference, understanding that health is our only wealth.
Thank you so much, Minister. And as mentioned, we'll now hand over to Mrs. Hannah Julianson Paul, the Permanent Secretary, Acting Permanent Secretary, with responsibility for hospital and community health services. Over to you.
Thank you, Ms. Johnson. And I just want to say good morning again to all of you and to our listening public. As persons tasked with the responsibility for the strategic and operational function for hospital and community health services, as Minister alluded to earlier, we would have started having our meetings with our respective management teams. And we would have conducted 2 such meetings with hospital management. And since then, we have identified some of our challenging areas, and we are trying to put together the plan for the way forward. And out of these meetings, what we realized, we came up with some priority areas for improvement over the next year. And these areas included the surgical department, oncology, our diagnostic services, electronic medical records, decentralization of services, the reconstructing of our primary health care services, and also the improvement in our human resources. The reconstruction of our surgical department would take the following format. We already have a plan, and discussions have already been made with the consultants and house officers within the department. We commence the purchase and continue to purchase equipment in order to equip our surgical department and ensure that we have the capacity to provide that service. We're going to also strengthen that department by hiring a pediatric surgeon / oncologist. So we're getting 2 in 1, yes, to improve and strengthen that department. Dr. Tristan, who is going to be the person delivering such service, he would be performing surgeries for pediatric cases. Most of you might have heard before about our World Pediatric Project, of which Grenada is part of. This project had enabled us to access surgical care in whatever form for our pediatric cases, our children. Because of COVID, we would have seen a lot of the borders of our regional islands has been closed, and that would have affected the access to care. So COVID has taught us that we need to have this sort of specialized service within our country. And because of that, these were some of the reasons that prompted us to recruit the service of Dr. Tristan. So he would be providing that service. The medical director already started collating the names of persons for that service. Persons who also has problems with the urinary tract, problems with the urinary tract issues, problems with male that have problems with the reproductive organ, like prostate cancers and so on, he would be addressing some of these cases as well. We have also, I'm going to be instituting or recommencing the team approach towards surgery. So we would have 3 surgical teams operating from the 2nd of November, and that approach would enable us to see a reduction in the waiting time for surgeries. We have all heard the complaints of the length of time that a person has to wait for a surgical procedure at our general hospital from the time they first interact with the public service. And we are putting these measures in place in order to reduce this waiting time. So we are proposing, and we know, as in everything, sometimes we have little technical difficulties that would happen from time to time, but we are proposing that with that measure, we are going to see persons interacting with the public service from the time that you interact with the surgeon. If you are diagnosed with cancer and need a surgical intervention, your waiting time would be between 2 to 1 month. If for ordinary surgical procedure, other than the cancer related, we are looking at a waiting time from the time you interacted with the surgeon to up to about 3 months. So we have seen a drastic decline in the proposed time, because we know that previously your waiting time could have gone from 6 months to over a year. So we are really, really happy for the collaboration with the surgical department, and we embrace this opportunity because we're going to see a tremendous impact for persons who are on the waiting list. Our oncology department, our cancer program, that area too would see some improvement, because we are aware that cancer has become the leading cause of death in our island. Yes, and again, COVID has, most of our cancer care is sought outside of our country. And because of that, COVID has again taught us that we need these resources within our country. And here we are going to try to develop a partnership in order to be able to improve what we do at our cancer program. This cancer program would not only be based at General Hospital, where we speak about treatment and care, but also that program would be linked back into primary health care, because we have to develop and ensure that the preventative strategies are in place. And we are speaking health promotion and education of our people to empower them to understand why they need to conduct early screening so that they can be diagnosed early and therefore they can be referred to care in a timely manner in order to prevent what further complications. Okay. We're also going to be looking at our lab services. Presently, we are in the process of relocation of our lab from the old present building to the new phase of the hospital. Our lab services are going to be improved because we are procuring new equipment, and that is being done through the Regional Health Project. It is a World Bank project which would allow us to, because over the years our equipment have been deteriorating and some of them malfunctioning. So we are improving that department by providing them with new equipment. Over the last 2 weeks, we had 2 technicians on island installing this equipment in the new building. So we do not want to have any disruption in our services when the transfer takes place. We want a smooth transition. Therefore, we are ensuring that all of our equipment are installed, they're operational before that transition takes place. We also are looking at the introduction of laboratory services to Princess Royal Hospital and the Princess Alice Hospital within the first quarter of 2021. And we know that the people of Carriacou would welcome that. The people of Princess Alice would really welcome that because of the cost in transportation, the length of time sometimes that they have to take to get to the general hospital to do some investigations. So we are trying to reduce the burden on our population and bring services to them, making it accessible and available. We're also looking into our X-ray services within the first quarter of 2021 for Carriacou as well. Since coming in, we have since hired 2 laboratory technologists for the department because that department is really understaffed, and with the increased amount of demands now in relation to COVID and COVID testing, we really needed to improve the staff quota there, and we have since employed 2 technologists, and we are in the process of waiting on finalization for another 2. The electronic medical records, this area we really have already been implemented, but it has been in primary care. So the electronic medical records is up and running in the primary healthcare services, but not yet at the hospital services. So we are going to ensure by the first quarter of 2021 that the continuation of the electronic medical records are done. This is needed for efficiency in care. It would help to duplicate efforts. It would promote early diagnosis and treatment, as the physician now would have access to the patient record from the time they enter our service, when they are referred to them, and so the plan of care can become an easier process. It would also help us to reduce our waiting time and improve our follow-up care for persons within our system. So the electronic medical records become a very critical part of care for our patients. Decentralization of specialist clinic service to improve access. Presently, we have specialist clinic access at the Princess Alice Hospital for obstetrics, gynecology, pediatric service, surgical services for specialist clinics. However, we are going to improve on that, and we're going to extend that to ophthalmology. We're going to also include orthopedic services there. We're not going to only leave it at Princess Alice Hospital, but we're also going to bring those services at the level of the health center. So all of the other services that presently offered, like pediatric surgery, gynae and obstetrics, we're going to add ophthalmology and orthopedic, and these services would also be available at the health center level. Our goal is to bring the service to our clients, our patients, making the service accessible and available to them. At the Princess Alice Hospital, we have also submitted in our budget for 2021 the first assessment to be done at the Princess Alice Hospital for the introduction of minor surgeries at Princess Alice Hospital. So we are looking to improve in every area and make services available to persons. We would also be looking at our regularization of our staff, especially our nursing personnel and our doctors. We will be looking at regularization, and we hope that this is something that our staff is looking forward to, because I can assure you that we are putting every effort that we have into that regularization. Presently, we are not forgetting our infrastructure. We know we have the second phase of the general hospital is being done. However, we still continue to utilize our first phase, or what we call our current building of the hospital. And so we have to ensure that that building too gets its level of improvement, and we are presently installing 2 new elevators. From time to time, we all hear about the elevator and the issue with the elevator, and the elevator is not working. We are presently installing 2 new elevators at the current building in order to ensure that that facility is up and running, because we know our operating theater and so is on our 4th floor. So we definitely need to have a functional elevator in order to be able to function effectively. Primary healthcare we have not met with the management team in the primary healthcare as yet. As Minister said, we are meeting with them this week into next week. But coming out from the discussion with hospital services, we realize that we have to restructure our primary healthcare services. The purpose for the restructuring of this service is to strengthen our first line level of care, which we know and which has been proven not only to be cost effective, but it helps to address our health issues in a holistic way. All right, especially right now with the prevalence of non-communicable diseases, we have to look at strengthening our health promotion and our disease prevention within the primary health care. That is our focus going forward, right? We want our primary health care system to be able to attract patients to utilize our primary care. This would ensure that the existing structure and outdated disease profiles do not consume the required resources that we have, but rather that the health centers provide services that are in demand by our patients today. We have already submitted our staffing needs for that restructuring within our budget for 2021, and we would also be doing some renovation on our health centers, because I'm not sure if you're aware, but Health has taken the approach of the SMART initiative, making sure that our health facilities are smart, they are resilient to withstand whatever health emergencies and disaster that they may face. And we already have our health centers done for smarting come 2021 into 2022. Our new health facility at WeiVybz is not forgotten. We have a new health facility there, and we will be adding some services in 2021. However, our approach to WeiVybz would be introduction of services in a phased approach. We cannot do everything at one time. So going into WeiVybz, we would have the regular services that has been offered presently. We would be adding our dentistry service, and we would be having an extended hour of medical services there with an emergency or on-call service. And when we say emergency or on-call, we mean that the doctor, the nurse, the emergency response team, it will be available at the health facility after the hour of work. So if the extended hour is up to 8 o'clock, after 8 we would have the emergency response team being on call at the facility. So these are some of the areas that we have looked at so far. I know one of the questions that might come because it has been in the media for a while. So before it comes, is dialysis. And it's not forgotten. We have not left dialysis out. Presently, we are just finalizing all of the logistics as it relates to dialysis. And when we come back another time, hopefully very soon, we would let you know the tentative date. But it shouldn't go beyond the first quarter of 2021. Thank you.
Thank you so very much, PS Mrs. Hannah Julian St. Paul, Permanent Secretary with responsibility for hospital and community health services. Colleagues, we do apologize because we are having some internet issues, so we hope you were able to follow either on the GIS channel 22 or on the Facebook page. And here is where we open up the floor for questions. We already had one from Nancy Maguire, so I'll just go ahead with that still while you submit your questions as well. So, the Minister, what are the requirements? It's kind of outside of what we spoke about this morning. What are the requirements for a person returning to Grenada after spending 6 days in St. Vincent with regard to PCR testing?
Well, the truth is we are not here on that thing, but that particular aspect as it relates to COVID. But what I show is that PCR testing must be done across. So you must come with a negative PCR test. From whatever country you're coming from, you must have a negative PCR test.
We have another question. In terms of the equipment that is supposed to arrive as we seek to ensure we have everything in place, modernize the services, how soon will this equipment arrive?
Well, we're talking about different equipment, so... Yeah, so for the urology equipment, we are hoping that in the next 2 weeks or so that will be here, and there are some other equipment that we are hoping within the next month, 2 months, and some before the end of the year. But there are others that will be after the 2021 budget, but it depends on exactly what they're asking about.
You also mentioned about the Adopt Award. What is the process that will be put in place for this?
So we just started the process because it's something that came up while we were cleaning some of the businesses. I think one of our doctors or someone raised the issue of adopting award, and it came across good for the persons who were there, and so we started talking about it, and other business entities hearing about it thought it was a useful initiative. And so we even contacted other persons saying, this is what we are thinking about. And some persons called to say how happy they were with us doing that cleaning, and they were business persons that wanting to be part. So we also let them know that one of the things we are thinking about is adopting award, where, as I said, the real aim of adopting award is that you will ensure that it is always beautified, so there's no issue of painting issues or molding issues, or sometimes you have one door, a glass from one door, or some door need replacement, simple things like that, just to keep the environment looking clean and welcoming. So that's basically what the Adopt Award is about, and we are expecting more businesses to come up, but thus far we have 7 business entities who will be involved in that process.
Right. What kind of focus, Minister, will be placed on the Mungay Hospital? MTV is asking what kind of focus will be placed on the Mungay Hospital and its development improvement?
Well, as I always said in the past, Mungay Mental Hospital is dear and near to my heart. I have been there many times before becoming minister, and even becoming minister, I have been there, and I understand that and see for my own self that there are a number of issues with patient care, issue with the whole facility. And so in terms of improvement of the facility, we will be looking at that in terms of having discussion with the doctors and see how we can better care for our persons with mental illness, and how it more than just Mungay, because Mungay is just an institution when you no longer can control them at the community, but how do we provide love and care as even family members? So even the education aspect must be there, because Mungay at this present time, we have scores of people there who have families outside there, but they are there in Monge living permanently. So we want to ensure that families understand that mental illness is an illness as any other illness. If they take the medication and you provide love and care, they can be out with you for a long period. For example, my mother normally stays out for a whole entire year, being like a normal citizen, doing all of things, cleaning and cooking and doing all things. And then maybe sometime later on, it's like a moon kind of thing. She will get sick and having to go for 4 to 6 weeks there and then back on the community. So we have to teach our families and educate them that mental illness is not a means to throw away your relatives. It's a means that you can care for them, you can love them, you can ensure that they take the medication. And sometimes it's not that easy. So we can sit in a corner and say, well, take your medication. But sometimes it's not easy if you're not there to slip it in their tea, and sometimes they believe that nothing happened to them. And so, but the love and care that you provide as family members must be crucial. You can't just take your families and just like dump them in Monge and never show your face again. That is unacceptable. It's inhuman. It's everything you could think about. So we want to provide the proper education to our people, to say to them that just like how we have cancer, people lose limbs and also have that, and they're on dialysis and they are home in the community, coming for treatment and going back home. Mental illness is similar, and so it must be treated in that way. So education is key in terms of discrimination, because families have to deal with double kind of things when it relates to that. So you deal with the whole issue of your parents being ill and the whole issue of the impact on medication having them shaky and all that, but you also have to deal with the discrimination within the community. And so our education aspect must be key in terms of ensuring that that can happen to any family, and to ensure that family members and even the community at things should understand and be able to deal with that particular issue. So it will be a double approach, a multidimensional approach in how we deal with mental illness and hold facility improvement. But we will be working along with the team to see what can be done to improve and give their facelift and provide better care for persons who are mentally ill.
So as a follow-up to that, Minister, you did mention about love and care, and beyond that, somebody is asking again, what measures are in place to help them to ensure that they do not have a relapses? Are there any things that can be done, or as you mentioned, it could be the moon or something, so you never know with an illness like this?
Because there is the community program, so you already have the people involved in mental health having outpatient clinics. So there are the outpatient clinics. They also go to the homes of families. But there are sometimes, I am not sure what the really issue is, because I have to deal with it myself, that a particular period every year, from my mother's case, when she gets ill, every year around the same time, you could as well prepare to say, well, she getting sick a month or two from now. So I'm not sure if and because when you ask her, why she not living directly, you ask, you take your medication, and she'll always say she takes your medication, although sometimes medication meet medication day, so that too can be an issue. But I believe that it seems to be a moon issue sometimes. Maybe I could be wrong, because I'm not a medical doctor, but just on that particular, dealing with it over the number of years, I think, but still, we will continue the community intervention and see how we can provide more education. But the community intervention, we already have some, and it is happening at present.
Thank you so much. Colleagues, as I mentioned, we were having some internet issues, so we do sincerely apologize again. Are you hearing us now? Callistra, good morning. I understand you were hearing us. If you're hearing us, go right ahead with your questions.
Okay,
Yes, we are most definitely. Go right ahead.
Okay, thanks. Good morning, Minister. Decentralization of healthcare services and the primary healthcare, that's been talked about for a long time. For the last 20 years, at various times, you hear about taking the load off the general hospital and having more comprehensive services at the out districts and so on. What is different this time? You have rolled out an extensive list of engagement programs. What is different this time that can give the public the confidence that the objectives will be met in strengthening our primary health care and decentralization of our healthcare services?
So you would appreciate if we want to move forward. So I do not want to focus on what was said for the last 20 years.
No, no, I don't want you to focus on what was said
Yes,
for the last 20 years. I want you to
in
tell me what's different now.
the
The
difference
things that
is
you're talking about, a lot of it were planned and rolled out and never worked.
okay. So the difference is our commitment to providing those particular services, and in short order, you would see. So seeing is believing. So I can give you 100 reasons now. The fact that it's not happening yet, then you can say, well, I heard that before. So the truth is, I'll ask you to wait for a while and see. So then in our next press conference, you can identify whether things are happening or not happening, because we are putting all our efforts in place. We have a committed team, and so we are working at this time in doing all that we can to ensure that that become a reality.
The one of the things we've been hearing recently is that we are strapped for financing. Can you give me some sort of breakdown of where all the money is coming from to roll out these things? What additional requirements are needed to be paid for those objectives to be met successfully? And also a bit more details on Dr. Tristan. Who's Dr. Tristan? Does he have a first name, and what's his credentials and so?
So, while in terms of financing, while government has a drop in revenue, you would appreciate that health must be given priority, because without health, we really are dead, and therefore whatever little monies we have for other things cannot be used, because health is wealth. So government will be given priority, so from government's fund in some instance, and we also spoke of other regional intervention that is happening that will provide us with some of the assistance that is needed. But the government is committed and will provide all the necessary finances to ensure that we provide proper health care. The truth is, COVID-19 would have given us this unique opportunity in terms of dealing with and understanding and appreciating that we have to put more of our time, our efforts, and resources into healthcare, and so we are doing that. Dr. Tristan served in Grenada before. I think it's Jose Tristan. So he works, and maybe since now St. Paul, the acting PS St. Paul worked with him before, she can maybe give us some more details. But our health professionals are aware of Dr. Tristan. He worked with them here before. He is presently in Spain, but he even worked in other countries in the region at present. So she can tell us a little more of Dr. Tristan. But I know in discussing Dr. Tristan with me from the management of the hospital, he has a wealth of knowledge as it relates to surgery for children and for urology.
Yes, I want to support the information that Minister provided. Dr. Tristan has been one of our surgeon neurologists here in Grenada over a period of time. He would have returned to his homeland, and we realize that there is a gap presently in our service area. So this is one of the reasons why we had to re-engage him again. Dr. Tristan was also instrumental because over the last 3 or so years, the proposal for the introduction of minor surgeries within the Princess Alice Hospital was one of the objectives. He started working with us on that initiative as well. So he has played an integral part within our health system before he returned to his country. So he's not anyone new to our service. Dr. Tristan has been around. He has shown his expertise and competency in every area, and it was something that was proposed by the management team of the General Hospital. It wasn't someone that we engaged on our own. This was the person that was one of the person proposed for that service.
We have another question from our colleagues. Will additional personnel be required to carry out the approach to primary health care? Will additional personnel be required to carry out the approach to primary health care that we're talking about?
Additional persons currently, if we're speaking about our staffing within any one of our health facilities, staffing is a challenge. So, well, if we're talking of additional person in terms of expertise, I would say at this moment, no, because we do not need additional expertise to do what we need to do. Our service is already there. It's a matter of how do we go forward to improve those services. Our health promotion department, we already have a health promotion / education department, is a matter of strengthening capacity at this level in order to deliver the service. So it's not anything new. We are not reinventing the wheel of anything. These structures are already there. It's a matter of enforcing what is there and improving what is there.
Thank you so much, PS. Callistra, you have another question?
Yes.
Okay, go ahead. We're hearing you. Are you there, Callistra?
I'm here, Leslie, and
right.
I'm having trouble unmuting myself.
Okay, great. Go ahead.
The operating rooms at the General Hospital, the problem with the airflow quality and the cooling system, I know that the system we were using was not appropriate for that sort of a facility. Specialized cooling systems are required for operating rooms, and we were not using what was up to standard. Have we resolved that problem? I know Cooling Tech was the contractor on it at one point. What's the status of that situation, please?
Presently, the hospital management team is conducting an assessment, and that, what would I call it? That assumption that you would have made, and we are going to, based on the results of our findings, we are going to do everything in our power to ensure that our operating theater has the required and recommended AC units in there, because as we say, our goal here is to improve our services. We want to ensure that our citizens has the best service. So we do not want persons going into the operating theater, and at the end of the day, where a problem is supposed to be resolved, we create another. We are not here for that. So we are going to put everything that we can in order to improve what we do. But we have to wait on the results.
Thank you very much. Rachel Bain. Sorry, you have another question? Okay, go right ahead. Go right ahead.
In the operating rooms at the moment?
Yes, surgeries are being done because, as I said to you, that whatever is being said, we do not have any documented evidence of that at this point in time, right? And the operating rooms measures would have been put in place to ensure that surgical procedures are being done in a safe environment.
That's it for now, Callistra?
Yes, thanks.
Okay, great. Rachel Bain, good morning, MTV. Are you there?
Good morning. My question, Ms. Minister, is with regards to the mental home, right? Reports are the mental hospital is short-staffed, and oftentimes they have security officers administering medication, including giving patients injections. What does the government plan to do about that?
So, Rachel, the government doesn't have that information that you have. In fact, I've visited Monge, met with the doctors, met with staff there, and that never came up as an issue. So this is the first time I'm hearing that is from you this morning.
Do you have another question, Rachel? Rachel, are you there? You have another question? All right, colleagues, anybody else with questions?
If no one else has a question, sorry to be hogging the show. Is the minister in a position, I know she is hospital and health services, but is she in a position to speak at all on the COVID-19 situation? Anything new has developed recently? And with all of your planning and engagement on primary health care, how much of a factor is COVID prevention, the spread of the virus, being considered in your aspect of the health portfolio?
So as it relates to COVID, I cannot give you any information at this time. I'm not privy to any new development as it relates to the COVID-19 coronavirus, and so I am not in a position to give any information on that. As it relates to prevention, well, the whole aspect we spoke about as it relates to education, wearing your mask and all this thing is what we have to do in terms of preventing the virus from spreading. So what we have been saying all the time, the education promotion, and that have to be continued, and at the level of the school, at the level of the community, and encouraging our people to protect themselves and their families, build up their immune system, because COVID-19 is here with us, and as it seems, it will be here with us for a while. We cannot shut down the country forever, so it means that as it seems now, we'll have to live with the virus, and therefore we'll have to take all preventative measures to protect ourselves and our families.
Can I just want to add that
Just hold a sec, Callistra. Callistra, just 1 second. The PS wants to add something. 1 second, please.
I just want to add to that to say that disease prevention, disease surveillance is a critical part of public health, right? And public health falls under the primary health care. So as a result, the identification of diseases, the prevention, control of diseases forms an integral part of primary health care because of the public health nature of which it is. So there is no primary health care without disease surveillance or public health.
So, Callistra, you can ask your other question.
The country, people have been kind of focused on COVID-19 to clean up the country so that we can deal with the dengue problem. I remember years ago when we approached dengue, it was always approached from a primary healthcare standpoint. Anything like that in the works?
It's an excellent observation from you in terms of cleanup campaign and national cleanup, but we have not discussed national. What we're doing in terms of the promotion is encouraging families to keep their surrounding clean, and to ensure there's no stagnant water, no tires, flower pots and all that, to protect themselves from dengue. But I agree that maybe in our promotions we can look and urge people to be involved in a national cleanup campaign.
Okay, Callistra, thank you. If you have any other questions, just hold a sec. Nancy, good morning.
Good morning.
Right. Yeah, Nancy, go ahead. We're hearing you. Go ahead.
Okay, thank you. I want to go back to mental health and the services provided at the Mount Gay Hospital. In terms of helping people with addiction issues, will you be enhancing the services there? And to combat some of the financial challenges relating to these issues, does the government have any position on getting the producers of rum and beer and the corporate community to support addiction? Thank you.
So let me start with the last part. I believe that corporate Grenada, maybe you add in terms of the rum factories and stuff and things, so maybe these are people that should come on board, but I know that there are aspects in terms of who are assisting in terms of dealing with rehabilitation and the rehabilitation center. What I can say to you that as part of our 2021 budget, we will be looking at rehabilitation, and so I would not give in-depth information this morning, but it will be at our budget, when that budget is presented, we will speak up to what will be happening in 2021 as it relates to dealing with substance abuse and providing more assistance as it relates to getting people to deal with the issue of alcohol and substance abuse.
All right, colleagues, I think it is time for us to wrap things up here. And again, we do apologize because we are having some internet issues, so that keeps dropping the connection with us. So what I will do is give the PS an opportunity to make any final words that she has, and then we'll have the final word from the Honorable Minister.
Leslie, I just want to say thanks for this opportunity to introduce ourselves and our plans for hospital and community health services today. We look forward to working along with the team that was given to us, and we are committed to providing the best quality care to all citizens of this nation.
Thank you. Minister?
Just to say that I am happy to be involved. It's a challenge. It has been consuming all of my time for the last 2 weeks. When I say all, I literally mean all, because I literally sleep, dream of healthcare, the improvement of the healthcare services, because I believe that I was given that responsibility for a reason, and I believe, as I wrap up, I would say my son, after Prime Minister announced, my son who's studying medicine said to me that you are expected to make a difference. You can't waste time there. You have to do what it takes, and people, all eyes are on you to make a difference. And so I'm aware that eyes are on me, eyes are on all of us at this particular time. And so we are committed to working to improve the health services across Grenada, understand and appreciating that from where I sit in the ordinary realm, I am aware of those issues that confront our nationals and even confront me at sometimes. There are times when I had to even as a minister, visit the hospital with my mother and saw the many challenges. And so we are committed to doing what it takes to improve the general health care. We are committed to working along with our staff. We are committed to dealing with even the issues and challenges that confront our staff. I know in our first meeting, Dr. Donald asked me whether or not she's frightening me, because there were so many issues and so many challenges. But the truth is, when I listen to the team that we are working with, I know the passion, I know the commitment, and so I'm joining with them with passion and commitment to improve the healthcare services of Grenada, Carriacou, and Petite Martinique. You can count on us that we will be making changes, and we're not focusing on all those things of the past. We understand and appreciate that health have a number of challenges, a number of issues, but we'll work together. And we know we can't change everything overnight, but we will do some by some, little by little. We believe that we will be able to change some of the perception as it relates to healthcare in Grenada.
Thank you so very much, Honorable Minister Delma Thomas, Minister in the Ministry of Health and Social Security with responsibility for hospital and community health services, and Mrs. Hannah Julian St. Paul, the Permanent Secretary with responsibility for hospital and community health services in the Ministry of Health and Social Security, giving us a lot of information there this morning. Colleagues, we do apologize once again because we know you missed some of it on Zoom because of the internet issues. Sometimes that happens with technology, but of course you can join the Facebook page. You can get the information on the GIS Facebook page. So for all of you who joined us this morning on Channel 22, our Facebook page, and in the diaspora, and our colleagues who are always with us every Tuesday morning at this time, we do say thank you very much. Have a wonderful day, everybody. I'm Leslie Ann Johnson. Thank you.
self-isolation. Stay home. COVID-19, one has a fever and cough or other symptoms of respiratory illness. Avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.
HARDTALKGrenada.com. You're listening to Hard Talk Grenada via www.hardtalkgrenada.com.
Good morning. It seems like I'm having a little bit of technical difficulty here. Good morning. I'm hoping that those of you on the outside is able to hear me. All right. Good morning to all of you joining us on the various radio stations, whether it's on 97.5 CitysoundFM, 89.5 CRFM. I think that fixed my issue. I wonder what happened there. Mr. Bola, I seem to have been having some technical difficulties. No, I'm good now. Yes, I'm good now. Good morning, Grenada, Carriacou, and PT Martinique. And thank you for tuning in to Hard Talk Grenada on whatever radio station you're joining us from, whether it's 91.9, 91.5 RealFM radio, all the way to Carriacou in 92.9 Sister Al radio broadcasting from Hillsborough. And of course, if you're in the diaspora listening to us on 94.9 We Noise radio, we say good morning to you. Of course, a special good morning as well to those of you who are joining us on the live video. We're just coming off of the heels of a post-cabinet briefing that was facilitated by the Honorable Minister Delma Thomas, who is now Minister responsible, in addition to her other portfolio as Minister for Social Development and so on. She is now Minister responsible for hospital services, and she has, of course, just rolled out along with her team an extensive plan on how we are now going to improve our hospital services, how we are now going to improve a lot of the areas that they have identified to be problematic, a lot of the areas that, have been identified over time as well to be problematic in our healthcare system. And, we have always, we've never alluded to the fact that everything is perfect in healthcare. We've always identified that there are issues, there will be issues, and that is just how life is, That's how things grow, that's how things develop. In order for you to fix something, it must be a problem first, right? Of course, with me in studio for this short period that we are here on a Tuesday, it's Mr. Bola, my co-host. Good morning.
Good morning, Ms. Duncan. It's wonderful to be here again. Good morning to the listening public. I do hope that many of you had tuned in at your normal time so that you had an opportunity to listen to the minister and, of course, her PS. In that new area, it's the issues and challenges are not new, but it is the first time really that we have had a minister dedicated. As a matter of fact, someone said COVID-19 has brought tremendous changes, some for the good, some for the worse. And in that case, in Grenada, we now have two ministers dedicated towards health.
Yeah.
So we have a split Ministry of Health, and now we have hospital and community health services being separated from, all of the other health issues, health and wellness issues. So, which is something that in recent times, health and wellness has been taking its own shape. More now as an area of investment. And there are some jurisdictions already where there have been significant investment in that area, where a lot of the people of high network, if you want to net worth, not network, net worth. Yes.
Mm-hmm.
So actors and movie stars and artists, who has and some of the sports people whose annual figures are in the millions. These are the top clients that you're catering for.
Right.
Where the services offered, health and wellness, is slightly different to that of a hospital service.
Right.
So there's a separation. So they may not be mentally or physically ill, but they may want to take 2 weeks, for example, to be treated special, to be massaged, to get an opportunity to walk in the sand, to bathe on the beach, to get a suntan or the melanin to ensure that it starts working again, to be oiled and, rejuvenate themselves, get some kind of special treatment. So that is an industry that is developing, and it is significant that our cabinet and our government and our prime minister has the foresight,
right,
and or has taken the advice, if that was the case, to recognize that Grenada must not be left out of that. So there are some of the jurisdiction in the region, like St. Thomas and some of those high tourist destination. While I don't believe there's a separate minister in some of those instances, but they have separated health and wellness from hospital services. So hospital services is more like what our minister has just explained,
right,
where you actually deliver health care to people who are not totally healthy, who are not well. And that takes in different facets, whether it's physical ailment or mental ailment, whatever the case may be. And then health and wellness may well be. And of course, we've learned that development that is soon to start or has started, whatever the case may be, at Mount Hartman. A part of what they intend to construct will be that. Yes, that health and wellness center. That kind of, it's a medical facility, but it will not be dealing with people who have broken bones or have some sort of deformity
or
do a surgery
like
or something.
Yeah.
Or it can deal with people who have done a surgery after recouping
for recovery, but not to do the actual surgery.
Right, not to actually do the surgery, but to come and get recovery, get leisure time, be in a relaxed place and
to
atmosphere.
Heal mind, body, and
soul, and will be paying tremendously good sums for that kind of peace and comfort of mind. So I think we're heading in a direction where we can see, if done correctly, and if the investment made in that area is well enough, where we can see another angle for further economic growth, for job creation, for our people to benefit from what we can offer. Again, taking into account our friendliness, our sand, sea, and sunlight, but in a different sphere, in a different aspect this time. So it was good to hear, Minister, and I hope people were there online or listen to the radio and take in what was said, because it is, from when you listen, a breath of fresh air. My hope is that much of what was announced will be achievable.
Absolutely.
That the necessary financial and human resource will be in place to allow those things to become implementable, and of course to go on to give better service to our people.
And with that being said, Mr. Paul, I do want to appeal to our people, because even in the press conference, you'd hear Callistra say, well, a lot of these things have been said before. And you would hear some people often use the phrase, well, I watching and see. And I want to appeal to us that we need to move away from that mentality of I watching and see, and move into the mentality of, well, I want to support, or I want to be a part of. Because Rome was not built in a day. It's been all of 2 weeks since the minister has assumed her new position as Minister of Hospital Services, and I must say that she has hit the ground running. Over the weekend, I did come across some pictures, some photographs on social media of herself and Minister Lewis doing some cleaning of the external, as they said, grounds of the hospital. And
that must be qualified to say the Marigold, the Princess Alice.
It was the General Hospital.
The General Hospital.
The General Hospital.
Right.
And I want to also take this opportunity to say that it was such a shame to see people like with the likes of people like Randall Robinson and people like Ali Matura taking these photographs and turning it into something negative. Oftentimes you hear them complain about the condition that the hospital is in, and you hear them complain about nothing is being done in healthcare and so on. But here you have, or they're presented an opportunity where you could have reached out and said, how can I help? And their activity, what it did was triggered the corporate Grenada to now look at how they can adopt parts of or foster in some ways parts of wards on the hospital, or even initiatives being done in the hospital, and I looked at the situation and I looked at the comments that they made and how one would have highlighted all of the things that were wrong in the picture. There was some mold on the wall and so on, and things like that. Things that are not irreparable. Things that you can just, with the help of a few people who are willing to volunteer, you can fix these issues. A Saturday, a few men come out with a power washer, and you get a few masons and a few carpenters and a few business private individuals who are willing to donate the paint, and electricians who are willing to fix some fans. And you see, that is how we must approach these things. We must not look at it as a government problem. We must look at it as all a we problem. Because we want better healthcare, we want better services, we want better facilities when we go in there. But we also have to appreciate the fact that we have economic constraints when it comes to getting a lot of these things done. And where we can donate our time and our services as Grenadians will be, I'm quite sure, much appreciated. Because we may not have to utilize the service, but somebody in our family may have to do that. And even if someone in our family doesn't have to utilize the service, somebody does. Some child, some elderly person, some ailing adult. We must look at it in that way and stop looking at it as a government problem. It's not a government problem. Yes, government can do more to fix. Yes, government can do more to maintain. Yes, government can do more to implement. But we must understand that there must be a partnership between government and people. And it is only in that way, because we are a small developing state. We're a small island. We keep comparing our healthcare to places like the United States of America, where most of the healthcare is privatized. Where you have private individuals and corporations that are willing to pump monies into the sector because they are getting returns. They are receiving profit.
Very lucrative returns.
Of course. Our healthcare system here is basically free. You go into the hospital, you get everything that you need to be done, almost everything that you need done as an inpatient, and you don't have to pull $1 out of your pocket. I was speaking to a nurse the other day, and she was letting us know that, let's take for example the Guillain-Barré syndrome. That's something that is derived from Zika.
Zika, yes.
The same mosquito that gives dengue. And she was saying the medication to treat someone with that is 95,000 EC dollars. Government has to find that money to buy that medication. The people not pulling that money out of pocket. So we have to appreciate the fact that if we want better healthcare, if we want better services, if we want better facilities, we have to come down from our high horses. We have to stop pointing fingers. We have to stop wasting time making these little videos talking about what the CBI money could do for the healthcare system and what we feel is failing and all of these things, and start looking at it from the point of view where, how can I help? What can I do? Can I go with the ministers in the ministry in the hospital next week and help them power wash, help them paint, help them mop, help them fix a tile, help them wipe windows? What can I do to help? That is the approach that we must start taking towards these things.
Ms. Duncan, you have encapsulated everything in terms of where we need to be. But that is if you take for granted that all of us who live in this country are pretty much sensible, think with a sane mind, and appreciate the efforts of each other. And that is not necessarily the case. There are many of us who, even when something is right, will say it's wrong. Yeah. Because it suits our purpose to say it's wrong. It gives us the edge that we're looking for to say it's wrong. Yeah. So our foreparents have a saying, put your money where your mouth is. Of course. And I always wonder, what is that? Why do you put your money where your mouth is? You put your money in your pocket, probably in the bank if you have sufficient to put there. Put your money where your mouth. That's a classic case where we can complain very, very much.
And very good.
And very good. As someone else say, for every solution that you find, there are those who will get a problem.
Of course.
Right? It's not problems now to find solution. Yes. You find the solution, but they will dig up a problem some way. So they took the photos and they can identify in it everything that was wrong.
Yes.
So be it. What we need to celebrate and talk about is not so much what detractors and enemies of progress would like to focus on. Let us focus on the efforts being made.
Yeah.
Let us join hands, as you correctly said, and see how much more we can do. And it doesn't mean that one weekend, one Saturday, one whatever the ministers did last weekend is sufficient to fix all of the problems, because the problems and challenges with healthcare are numerous.
Yeah, it can't be.
And have been around for quite a long time. But of course now efforts are being made, because some of the same people who are finding problems with the efforts being made now were the same people who have been commenting about what is not happening, the faultiness of everything, and they have been commenting about it for a long time.
Yeah.
And effort is being made now. Not one opportunity to say, well, let's compliment you on the effort that you're making. However, though, we believe that you're a long way from reaching your target, so is the case. Yeah. Or this is what we are willing to do as people who are concerned. And that's why sometimes when some people speak, and we've said that on this program all the time, we must try to find out what is their motive.
Of course.
What is the expected results that they're looking for from having done or said what they say. I know the ministers are expecting, and rightly so, that if they go out there and show that they have a concern and they're willing to work, others may join in. And others did. You have corporate citizens, corporate Grenada, some coming out and say, look, we believe that we must step in and give some assistance. Adapt a ward or part thereof, as you say. Whenever it needs a little painting, we'll provide the 2 or 3 gallons of paint. We may be able to pay 2 painters for 2 days' work each to paint for us, or one person may provide the paint and another business provide some finances for paying a couple of days' work, or a combination of so many businesses can see, or there's a bed that is needed because one got broken or it has reached the stage where it no longer can be used by a patient or a mattress or a couple of beds. Whatever it is they can give, it means that they are now participating. They are now willing to help.
Yep.
And to help people who are in need. But the minister did not just stop there with their plans. They spoke to the fact that we need to have a greater level of involvement from an educational standpoint for preventative health care, which will be the most important thing. Because if we can prevent ourselves as people from getting to the stage where we get so sick to have to be hospitalized, it means that the pressure on the system will be less.
Yep.
It means that the demand for more funding for healthcare and the hospital will be less.
Yeah.
The very thing that the government is attempting to do by putting protocols in place and saying, listen, keep your distance, wear your mask in public and so that you don't get sick to have to get into the hospital that already have limited human and financial resources and probably even equipment, so that we stretch it to its limit where it fails, where it busts at the seams. These same people that are commenting about the ills of the efforts being made are the same people that are saying, well, there is no need to follow protocols.
Yep.
Right? So how can we ever trust that what you are saying is really honest and that your intent is really to help? Your intent is really to see betterment for our country. That's why we always have to question their motives. We're happy when they come on board. And the point is, like I oftentimes say, no one is saying that you cannot point a finger, and no one is saying that you should not criticize or highlight what you see as shortcomings. But you must do it in a manner that makes us know that you're doing it because you want to see better.
Yes.
You want to provide a means of assistance. You want to highlight something that we might have shadowed or not seen. But because you have a much more critical eye than the person involved, you are able to highlight and point it out to them. But rather, what we always get in some subtle way is total condemnation. It's as though what you're doing, the efforts you're making, the attempts that you're going after, they're useless. Nothing could get better. Yeah. Of course, that was their belief when they were in government between 2008 and 2013, because the then Minister for Finance and others used to tell the Grenadian people that in these times, 2008 to 2013, no one could do it better.
Yep.
That things are so bad. Economically, the world, is going through a depression, as they used to blame it on, and nobody. And within a year after, when the new National Party came into office, things change up until this day. Even when you're going through a time where the earnings or the takings of government revenue has reduced, this government has not yet failed, not 1 month, to pay the people it has to pay their salaries and paying it on time, to meet the commitment to creditors, to ensure that the private sector, who would have provided goods and services to them, that they are being paid. And they continue to do most of the social services that they have, the social dependencies, the people who rely on government for whatever little assistance. It continues to be provided. And talking hospital services, only this morning I had a conversation with a gentleman who pointed out to me that he was about to, whether it's today or tomorrow, he's getting a transport, to take a chair. It's one of those kind of chairs that you sometimes see them like on the airport. It's a kind of steel frame, and at least 3 people. It's one long thing like a bench,
right?
But at least 3 people can sit on it. There's a back to it, it's really a chair. And he said to me that his son fell from a building some time ago. And, had to be taken to hospital. He was taken to Maribor. He said, the ambulance took my son to St. George's on 2 occasions. He got x-rayed. He got treatment. He spent about a week or 2 in the hospital. When he was leaving the hospital, and that was Maribor he was making reference to,
right,
he got his medication to go home with, and it only cost them $5. He said, that's all I paid, $5 for all of the services that was provided for my son. Ambulance, transporting him up and down to St. George's and back, X-ray, what have you, treatment by the medical staff, food provided, and everything. And then he got medication and only $5 contribution. He said, I'd noticed going to Maribor that the sitting accommodation in the waiting room was very limited. And so I want to make a contribution of this chair to the Maribor Hospital.
Yeah.
And if it is possible that I can do 1 or 2 more, I will. Because I appreciate the services given at no cost.
Right.
It was only this morning, on my way here, that conversation was it, right?
Yeah.
So here it is. While we have a lot of people bashing, and maybe their experience was different to the experience that this gentleman had. Maybe they went in on a day, or they brought in one of their relative or their child on a day when the person who attended to them was having a bad day, and that's no excuse for not being sympathetic and treating your clientele, because a patient coming to the facility is the clientele of that nurse or doctor or orderly or whoever interfaces with them. And at all times in the provision of our service, we need to understand that we must do it with pride and dignity, and that we must make people feel welcome and treat them as though they are human just like we are. Treat them in a humane way. So we need to continue to train and to teach and to embark on these kind of principles. So there should be no excuse for you giving sloppy service or for I giving sloppy service. We're in the system and we must aim at all times. But your experience could be different depending on the day, depending on the who, depending on how they approach you, how you approach them, and the responses that
But
you
it
get.
doesn't mean the entire system
It's bad.
is bad.
Yes? And there are cracks in the system. There are places where improvement need to be made.
Yeah.
And here you have an administration that is admitting and saying, listen, we believe that we can do better. We believe that we have to do better. And in trying to do better and to fix some of the ills that exist within the health system, this is one approach that we will take. Yeah. We're going to put now a special department, we're going to put a minister in charge of hospital services, community health services. We're going to have a dedicated PS for that. We're going to have a team working and forgetting all other things about health and wellness and dealing only with the services of hospital.
Yeah.
Even without giving it an opportunity to see what the outcome will be, we start to criticize and talk about all that is bad about it.
Yeah.
Yes?
Yeah.
So
And we
something.
start using the phrase already.
It has been done, yes, and waiting and see. And not, well, okay, that's a new approach. That's something different. How can I help? How can I get involved?
Absolutely.
And helping doesn't mean you have to go there physically and do something. We can all help the system to be better and to be improved by ensuring that we take
care of ourselves
in the manner that we should, that we eat right, we exercise, we do the things that we should be doing, so that we don't get chronic and non-communicable disease, that lifestyle disease doesn't throw us down, that we have to rush there and have these people as though they are statues, they are placed there, waiting for when Roland Bola gets sick, or Marshall and Duncan get sick. We are there, we're ready. Oh, we knew you was going to come, so we have everything set up, everything is in place. Your bed is ready. Your food has been prepared. This is not our home. This for emergency, for accidents, for what have you, they always need to be a team that is ready to operate, to provide services, and that is going to take us to the level of the first world countries. Mm-hmm. Yes? But here's what. This comes with a cost, because there must be sufficient equipment. I think some time ago, I did hear the former minister, well, still the present minister of health, but the one who had all the responsibilities, did mention at a time that based on our population size and how they do the calculation for how many patients to an ambulance, that we were where we should be in terms of the number of operational ambulances that we had. I don't know what is the case now, because that was probably about a year ago when I already said so.
But then you would still find the people who would say, oh, well, we have 100,000 people. Why we have 5? Not saying that we have 5, but I'm just hypothetically saying that we have only 5 ambulance. That's not enough. And on any given day, we don't expect 100,000 people to get sick.
Well, that's what I'm saying. There's a mathematical calculation that they use to make a determination what per, ambulances you need per population size.
But Mr. Bola, I also want to appeal to us as a people as well. Instead of having those conversations on how many more ambulances we need, instead of doing, you see a lot of people now come up with little social media videos, wasting time condemning government. What if you take the time that you've had to be angry and to point fingers and to point out all of the ways that you think government is failing? Why don't you utilize that time to do a little research? Find a little video on how people can help improve their not only physical well-being, but their mental well-being as well, and post that. Do people a public service, Because when you go and you waste your time doing all these little videos condemning and spreading negativity, all you're really doing is just making people sicker,
Is that so?
Of course, adding negativity to their lives, sometimes when you have a lot of negative things and negative people in your atmosphere, it weighs down on you.
Well, I don't know much about that, because I don't allow negative people to enter.
I'll tell you what.
Into my being.
I'll tell
my
you what.
autonomy.
Sometimes, of course, because of my job, I have to look at some of these things and view some of them, listen to what people are saying because of my job. But I'm telling you, Mr. Bola, because I've never really been exposed to things like this before. I lived a very quiet private life as a teacher, as a mother, and I've just been, under the radar, doing my little singing, doing my little dancing, And I have to tell you that there are times now when I have to shut off, when I have to say, okay, I think I've consumed enough. Because it really does weigh in on your mental state and your physical. I actually feel myself physically getting sicker,
But you have to learn and adapt the skill to listen, to look, to hear, but not consume. Fishes live in the sea, which water is very salty. But if you taste the flesh or the blood, it is not salty. They have learned to swim and to strive and to survive in that salty water, but not letting it contaminate them. So you have to live and not allow these things to contaminate you. Rather, you must be that powerful with your thought and your actions that you must be able to make changes to the people who are trying to contaminate the society. And there would always be people like that,
Of course.
Not only in this era. They were there in the era before, and they will be in the era to come.
And they come in different forms.
In different forms. What we have to do, which we are aiming to do, but probably we need more people to join us, is to always try to point out these people whose role and functions are only to preach and promote negativity. And we promote the positive, because there's so many positive things happening around us.
Absolutely.
We are not saying that every single thing that has happened and is associated with the government and with this party has all been positive. But there are more positives happening than negatives. I mean, let's look closely. I mean, and sometimes as a people, I mean, there's a passage of scripture where the master was out with his disciples. I think it was at night. I'm trying to remember clearly what it was. And the waves started behaving bad. They were out in a boat. Right. And he had left them for a while, Peter and James and others, and went out praying. And the waves started getting really rough. And they were becoming really frightened, And he came and just spoke to the waters, and they were calmed. Right. And he was walking on water. And Peter wanted to go to meet him. and stepped out of the boat and started walking on water while he was focused in on Christ. That's the essence of the passage of scripture. But as soon as he was so elated about the fact that he could walk on water, that he took his eyes off the Lord and turned back to his friends, telling him, and he started to sink. And the essence of the story, and I may not be paraphrasing, I may not be verbalizing it as it is in the Bible, but in terms of putting it in my own word, the moral there is that sometimes we need to focus on where our strengths come from. Yeah. We need to be more focused on the things that are going to keep us doing what is good, what is right, what is going to be of assistance to people. And we must not allow ourselves to be consumed by the people and the things that will not help us and will not give us the impetus to help society. Yeah. Because they will be there. They would always exist.
Absolutely.
And we must not pretend that they don't exist. We can't pretend that and some of these people, sometimes they need help. Sometimes they do some and say some of the things that they say to get notice, so that someone. So we also, in the process of trying to promote what is good, what is progressive, in that process, we also have to try to help them, to elevate them, to take them from where they are. Yes? Some people are teachable, others are not. Some people accept a hands up. Others just want a handout and to remain where they are. So quickly we have to decipher what type of an individual or group am I dealing with. Yeah. Is it a group that wants a hand up, an individual that wants a hand up, wants to elevate themselves, want to learn better, want to be educated, want to do things the correct way? Or is it someone or a group of individuals that a group of persons that just feel happy to be as negative as they are and try to cheer down and pull down everything around them that appears to be positive, that is growing, that is blooming, that wants to bear good fruit so that people can eat and be healthy. There's some people like that. You can never do anything that is satisfying and positive enough to them for them to just stop for a moment and say, I appreciate that. This was a good deed. Yeah. This is something that we needed a long time now. This is the way we are supposed to go. Yeah. However, though, I believe we need more of this or we need to move that direction. Never a compliment.
Yeah.
Never a compliment.
I don't understand how someone can live their life in that wall of negativity.
And one gentleman called sometime last week and said, the people who are never prepared to give assistance or to appreciate what good things that are being done, they are not living, they're just existing.
Yeah.
So sometimes you have to be careful whether these people are living or they're existing. Yeah. And I want to say, because I think we're winding down for time.
We are already out of time.
That there's a saying that I want to leave us with. When everything is being done and you cannot find a solution to the problem, maybe it really isn't a problem, but it is time to accept it as a reality that you cannot change.
Absolutely.
Yes? So some of these people, not all, may just be at the stage where they no longer can have any change because for so long they have been engaged in negativity that the entire life, mind, body, and soul is being consumed by negativity. So that's the only thing they can see, they can say, and they can do. But I say, God help them.
Yeah.
That's all I can say to them and ask the Father to help them. I want to thank those who spend a little time listening to us. I hope that we did do or say something that in some way would have inspired you to want to be a better person. Remember, it doesn't matter how far down the road you have gone in the wrong direction, but you can always stop, turn back, and start going in the correct direction. Have a blessed and wonderful Tuesday. Take good care, and I hope to be with you, God's willing, tomorrow again.
Absolutely. Guys, well, we have come to the end of our program. As we say here every day, in whatever you say and whatever you do, be safe, be secure. We always want to be talking with you. We don't ever want to be talking about you. Please enjoy the remainder of your day and stay tuned for the National Report. It's always a pleasure being here with you.
With 2 more cases of COVID-19 on island, Ministry of Health says contact tracing will continue. We'll have details to this story and more in the National Report. With the details to the news for Monday, October 19th, 2020, I am Rikisha St. Louis. The Ministry of Health says contact tracing continues as an effective measure to control the spread of COVID-19 on island. Over the weekend, the ministry announced 2 new positive cases, of which brings the number of positive cases to 27. The ministry's public relations officer, Kevin Frederick, says all known contacts of case 25 are still in quarantine and will be retested later this week.
Contact tracing is ongoing. We have not suspended, our efforts. In fact, we have ramped up our efforts, with respect to daily contact tracing. Of course, whenever we finish contact tracing, our samples are forwarded to the General Hospital laboratory, where we do all of our contact tracing testing for the COVID-19 samples. So all of our samples collected during the contact tracing effort is sent directly to the national lab that's at the General Hospital, where our technicians will conduct the COVID-19 PCR testing.
He said the ministry is confident that its contact tracing efforts will continue to highlight all cases that can increase the possible spread of the virus.
On Friday night, the Ministry of Health announced 2 additional cases, which now takes our number of active cases to that of 3. And we have recorded in total 27 coronavirus positive cases on island since the first outbreak. What I could tell you too is that the persons are in quarantine. No one has been hospitalized, meaning that they have not developed symptoms warranting them to be in hospital. So they are all in quarantine at the respective quarantine sites. We are monitoring them as per our protocol, and of course we also announced that additional testing for persons in quarantine will be conducted later this week.
Continuing the news, Monday, October 19th, 2020 marked a significant day in Grenada's disaster mitigation efforts with the official launch of the Emergency Operations Center and Warehouse in Manjaloo. The $3.9 million project is part of an overall $6 million project being undertaken in Grenada and Carriacou by the United States government. Senator Winston Garraway, Minister of State in the Ministry of National Security with responsibility for disaster management, reaffirmed government's commitment to disaster preparedness, prevention and risk reduction, and construction of the facility fully demonstrates this commitment.
This Emergency Operations Center and Warehouse will be the Logistics Central Command and Control Facility responsible for carrying out emergency preparedness and management. It will serve as the focal point for coordination of the island's emergency planning, training, response, and recovery efforts. Also, it will reinforce collaboration with national, regional, and global partners, allowing Grenada to be part of the international network of preparedness.
Ms. Linda Tagliella-Taylor, U.S. Ambassador to Barbados and the Eastern Caribbean, says they are making an investment of more than $6 million to ensure that Grenada is resilient against natural disasters.
The United States is making an investment of more than $6 million in Grenada's resilience to storms, hurricanes, and other natural disasters. Here, we've committed $3.9 million, and on the island of Carriacou, we're constructing a $2.7 million facility. We previously funded the construction of 2 smaller emergency operations centers here in mainland Grenada, as well as one on Petite Martinique, which together are helping build Grenada's disaster response capacity throughout the country. Over the course of my time here as the American ambassador, the U.S., through the Humanitarian Assistance Program and other support, has helped build facilities and provide equipment for emergency operations centers and warehouses throughout the Caribbean. I am pleased to announce that the follow-on projects to provide equipment and furniture for this facility and the one in Carriacou have already been approved.
The Emergency Operations Center, the Disaster Relief Warehouse, will provide spaces for basic administrative functions. The project will be completed by March 31st, 2021. This is the National Report. The news will continue after the break. The importance of viability in the agriculture sector was highlighted when Grenada joined the annual World Food Day celebrations on Friday. Vendors, farmers, agro-processors, and local manufacturers displayed their products and produce at the National Stadium car park, giving patrons a variety to choose from. More in this report from Karima Lewis.
Grow, nourish, sustain together. Our actions are our future. A fitting theme for the observation of World Food Day 2020 as the world grapples with the agricultural challenges brought on by the coronavirus. Held at the National Stadium car park on October 16, the 2020 celebrations brought with it several exhibitors showcasing a variety of different locally produced fruits, veggies, and products. The exhibitors ranged from local manufacturers to farmers, inclusive of the Chinese Agricultural Mission. This exhibition usually gives the general public a chance to patronize the different stalls and get an understanding of some of the products that Grenada has to offer. Notwithstanding this, food security continues to remain a priority area for the Ministry of Agriculture. Speaking at his first official public event, Minister for Agriculture, Honorable Peter David, underscored government's commitment towards the transformation of Grenada's food and agriculture system.
We must improve market access to support the value chain development by engaging all the players involved in the marketing of local produce, thereby developing strategies to improve the quality of produce as we seek to get the best prices on the regional and international markets. Promoting technology and innovation in the sector is our desire in order and to engage our regional and international partners in promoting the use of technology to address the many concerns facing the sector. For example, in the fight against predial larceny, production of fruits and vegetables, management of pests and diseases, we must use our technology.
Minister David emphasizes the need to have stronger collaboration with research and technical institutions as a means of including technology into food production.
The Ministry of Agriculture must also seek to strengthen its own internal capacity to carry out basic research, thereby establishing the scientific foundation which is necessary for producing safe and nutritious foods in a manner that conserves natural resources, promotes sustainable yields, improves human health, and increases the competitiveness of the sector.
This year's celebration coincided with the 75th anniversary of the founding of the Food and Agriculture Organization, FAO. Due to effects of COVID-19 and the contributions made towards sustenance of the sector, the ministry, in collaboration with FAO, through plaques of appreciation, recognized farmers, vendors, fishermen, and retailers like Foodland, Food Fair, Real Value, and the Marketing and National Importing Board as some of Grenada's food heroes. For the Ministry of Agriculture, I am Karima Lewis.
Thank you, Karima. Finally, in the news, the Ministry of Infrastructure Development, Transport and Implementation met with vendors in the Melville Street area on Monday, following a cleanup and sanitization of booths on Sunday. The meeting served as a follow-up to a previous engagement when the ministry met with vendors in St. George's to inform them of plans for sanitization and retrofitting. Mrs. Marina Jessamy, Permanent Secretary with responsibility for infrastructure development and implementation, says the plan is to make the Melville Street area a no-vending zone and construct a loading bay for buses.
We had various meetings with vendors, and on the 8th of September, we met especially with the vendors of Melville Street, and we gave them letters indicating that we would like them to clean up the area and move so that we can have the area as no vending area. The reason is that we are working with the Division of Transport to construct a loading bay in this area. That loading bay will have toilet facilities. In the cleanup we had yesterday, we realized that sanitization is an issue, hygiene is an issue in this area, and we are really grateful for the one unit in our ministry, the Road Office of Bousséjou, under the leadership of Mr. Peter Charles. They did the cleanup yesterday. So I want to take this opportunity to call on the vendors to cooperate with us. This morning we had on-site meeting with 5 vendors whose booths are still here. The other vendors, they moved onto the stadium, car park, and we are making arrangement to move as well.
A second meeting is scheduled for Tuesday, since some of the vendors are concerned about the sale of their produce at the National Stadium car park.
One concern was expressed that based on the business that they have, like smoothies, they are concerned that they might not have traction at the car park. So we're still in consultation with them, but we are very grateful to see that the ambience is really enhanced.
That story just ended the national report for today, Monday, October 19th. Let's recap the top story. With 2 more cases of COVID-19 on island, Ministry of Health says contact tracing will continue. On behalf of the entire news and production team here at the Government Information Service, I am Rikisha St. Louis saying thank you for joining us. Until next time.
Stay up to date with all that's happening with the new national party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.